In this video, I'm going to demonstrate for you 3 specific chiropractic adjustments of the lower back region that I use on many patients when indicated. Now, these adjustments are very specific for the sacrum and also for the lower lumbar spine, specifically L5-S1. Hi everyone, my name is Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. My office is called Back to Health Chiropractic Center, and we just finished the day helping and adjusting many people, getting them a higher quality of life, a better quality of life and health through corrective chiropractic methods. We've helped people with chronic back conditions, things like low back pain, leg pain, sciatica, disc bulge, disc herniations, scoliosis, and other postural deformities and conditions that cause a lot of chronic pain for a lot of people. And we apply corrective chiropractic methods to help with this. I'm certified in chiropractic biophysics, which is one of the world-leading corrective chiropractic methods out there that we apply in this office. So in this video, I want to demonstrate for you these specific adjustments. And let me show you what it looks like on a spinal model first. And if you're new to my channel, be sure to click on that subscribe button and the notification bell so you get notifications on all my new videos that come out weekly, so you know how to relieve pain, conquer stress, supercharge your health naturally, safely, and effectively. So here's a plastic model of the spine. This is the lumbar area, the lumbar region, made up of 5 vertebrae. There are discs in between. Normal, natural alignment of the spine is straight from the front. It does have a natural curve from the side. The low back is a natural elliptical curve. That's the ideal model of the lower spine. Inside, the spinal cord ends at about L1, L2, and then there are nerves, spinal nerves that branch out from either side of the spine, and then the entire spine, spinal column from neck to low back sits on top of the sacrum. And then the sacrum is this strong, unified bone that sits in between the pelvis. And oftentimes when there are misalignments of the sacral region, the sacrum can jam into the pelvic area, so the sacroiliac joint is now immobilized or not functioning very well, can cause a lot of irritation and inflammation there, and either trigger local pain and also refer pain down into the thigh towards the knee. And whenever there is a misalignment of the sacrum, there can also be a misalignment in the lower lumbar spine as well. So when the sacrum misaligns or subluxates, as we call it, forward and down, that's called an anterior inferior sacrum. The lumbar spine, L5, also rotates to the same side. So that's a spinous rotation to the right. I'm not going to get too technical, but there are ways that we analyze this. And when it's analyzed properly, then we can actually correct it properly as well. And sometimes the actual sacrum can be rotated and jammed, and it jams up right against the pelvis as well. That's called a rotated sacrum. So this adjustment that I want to demonstrate will be 3 adjustments. There'll be 2 for the sacrum and then 1 for the lower lumbar spine, which is L5. And one will actually correct the anterior inferior sacrum, and the other one will correct the rotated sacrum, and I'll demonstrate that in a moment. And I want you to understand that when these misalignments occur, they may not always trigger acute inflammation or acute pain, but the inflammation can build up over time and strain, and these misalignments can strain and stress the tissues, which are the discs, the nerves, the ligament capsules, the muscles and tendons, and they can send a whole barrage of bad information to the brain. Now the brain has to send corrective responses down to try to improve things, but when they're structurally out of position, structurally misaligned, all you're getting is muscular compensation and contractions and postural distortions, leading to more and more problems. And just imagine if that exists for years and decades, it can not just lead to chronic postural problems and chronic back issues and pain issues, but eventually can lead to accumulation of chronic inflammation. It can irritate the nerves. These nerves go into the glutes, the buttock, the thigh, the foot. If these nerves are irritated now, they can cause sciatica-like symptoms or leg-like symptoms. The discs get distorted over time to become damaged, and it can cause bulging scenarios that causes more chronic pain. So if these misalignments and distortions, if they're not corrected and not caught and corrected early, they can lead to a lot of chronic degeneration, can lead to degeneration in the long term, and a lot of chronic problems and chronic pain in the long run. So it warrants certainly an investigation, an examination by a good chiropractor to look at your spine and to see if it's aligned properly, and if not, needs proper corrections and adjustments to do that. So that's what I want to show you in this video. I'm going to do 2 sacrum adjustments and then 1 lumbar spine adjustments, and I'll use my drop table here to demonstrate, and one of my assistants as a model to demonstrate as well. I'll be back in a moment. And I'm back, and I hope you enjoyed watching that brief segment of those spinal adjustments. You can see that the table takes up a lot of the energy and the thrust. It's very, very gentle. Patients love it, and it actually is very, very effective. And people that come in with chronic back conditions and chronic symptomatology over time begin to actually get correction of these mechanical distortions, biomechanical distortions called misalignments or subluxations. And when you begin to correct and align them properly, that correction begins to hold and stick, and then gives the actual tissues a chance to reset properly and eventually decrease that likelihood of inflammation, that insult on those tissues, which now allows proper healing to occur over time. And that's really what we do with chiropractic, is correct the structural problem and allow the healing to occur without using drugs, without using surgery, because I truly believe something like surgery for the spine should be a last resort situation. And yes, I understand drugs may provide symptomatic relief. I get that sometimes, and sometimes they don't, is what I hear from my patients that have chronic pain. But you can't live on drugs all the time. You can't depend on them all the time. You owe it to yourself to find out what this problem is and get it corrected. And that's what chiropractic care does. So I showed you in this video some segmental chiropractic adjustments of the sacrum, 2 in fact, and then 1 of the lumbar spine. And these adjustment techniques, as gentle and effective as they are, has helped many of my patients that have come in with chronic back conditions, whether it's local back pain, whether it's sacral iliac or buttock pain, whether it's pain referring into the thigh, knee, into the foot, leg and foot, because the tissues and nerves around the lower back region, or whether it's a pain and symptoms associated with disc bulges, disc herniations. A lot of these situations are because the spine was distorted and misaligned for a very, very long time and just was never corrected properly. And that's what we do as chiropractors, and that's why a lot of our patients get a lot of relief and improvement of mobility and flexibility and overall quality of life, and just overall happier because they're doing a lot more with less pain and no pain in many cases by applying these corrective chiropractic adjustments. Hope you found that useful. Once again, if you have any questions that you have, general questions, I don't mind answering them. I love to answer them. Leave them in the comments below. And I want to also know what you've done with your chronic back pain or chronic disc condition or leg pain. What kind of things have worked for you? What kind of things have not? I'd like to hear about that. And if you enjoyed this video, I will do more of these demonstration style videos in the few coming weeks. And so please subscribe to this channel by clicking on that subscribe button below and tap on that notification bell so you don't miss out on any future tips and demonstrations and strategies I give to help people get through their chronic spinal conditions and pain conditions that are associated with chronic back problems. And you can learn more about the corrective chiropractic care as well. Dr. Walter Salubra here, coming to you from Vaughan, Ontario, Canada. Thanks for watching, and I'll catch you on the next video. To learn more about how corrective chiropractic care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.